Buprenorphine is an FDA-approved medication that helps people with opioid use disorders by reducing cravings and the symptoms of withdrawal. Buprenorphine therapy is an evidence-based practice that increases a person's ability to participate fully in a comprehensive substance use disorder treatment program. Lynn Madden directs the APT Foundation in New Haven, Connecticut, which offers medication-assisted treatment for opioid use disorders with all of the currently FDA-approved medications. In this video, Dr. Madden shares strategies for securing buy-in for medication from staff, patients, their families, and the community.
Substance abuse treatment is a young field, right, compared to other medical specialties. So we've been thinking and talking about this as its own field for 4 or 5 decades, not longer. And the tradition of substance abuse treatment has really, generally speaking, been abstinence-based, and medications have been introduced more recently to a field that has really used abstinence from illicit substance use or abstinence from problem substance use as the gold standard. Right? What we know now is that medications like buprenorphine are more effective than simply asking people or helping people to be abstinent. There is stigma attached to the disorders themselves, and I think that stigma attached itself as well to the use of medications. And I find that presenting prescribers and clinical providers with information is a way of helping them to embrace the use of medications for the treatment of opioid use disorders. Securing buy-in is critical to making any kind of successful change in an organization. It's important that the people who work in an organization support the methodologies that are used to do anything, no matter what kind of care or product an organization is actually supplying. People who work there have to believe in order for that belief to reach the patients or customers in a meaningful way. I think the strategy is the same, basically, no matter who you're talking with, right? The main strategy is information, is disseminating information about how well these medications work and how they are the evidence base for the set of disorders that we're talking about. So in every part of the healthcare field, providers always want to provide to their patients the best care that they can. But I believe that there are many healthcare professionals, not just addiction medicine professionals, but many healthcare professionals who do not have the information that they need about the effectiveness of the medications. The reality is that having a person with an opioid use disorder or any addictive disorder is highly stigmatized in our culture, and that includes in our culture of clinical and medical treatment. And that has been true for a long time. It's particularly true with opioid use disorders because by definition the use of heroin is illegal, for example, or the illicit use of prescribed medications is against the law. So by definition, all of the people essentially who we call opioid use disorders have committed crimes or have behaviors that seem difficult for prescribers to manage. So there's a great deal of stigma related to the diagnosis itself, and that stigma has kind of flowed to the provision of the treatments as well, right? So that the medications for treating opioid use disorders, such as methadone or buprenorphine or Vivitrol, are also highly stigmatized. APT Foundation has been providing methadone treatment since 1971, so it's really a pioneer in the use of medication-assisted treatments. It was initially formed by the Yale School of Medicine Department of Psychiatry, and much of the research that supports the use of MAT or medication-assisted treatments has come out of Yale and other surrounding institutions who have been able to use the APT Foundation as a site for doing clinical trials or understanding how the effectiveness of the medications can be enhanced. What we weren't doing at APT as much of as we are now is using buprenorphine and other medications. That being said, I've had quite a lot of experience in other organizations as a NIATEX coach, trying to help people introduce the use of medications to their communities, to their prescriber groups. And I do think that it's very important to have that conversation up front. And I think the basis of the conversation is highly predicated on the use of the evidence that we have. So introducing evidence to clinical and professional people is a method that they've always used to learn. It's just that many people haven't had the opportunity to be introduced to this evidence. So a critical way of overcoming provider reluctance is really to introduce them to the situation in their community, in their state. What I find is that it's very important for leadership at several levels to be bought into the use of a treatment of any kind that they haven't introduced before. So as organizations introduce medications for the treatment of opioid use disorders, it's critical to have a clinical champion, a person who understands the use of the medications and is passionate about the necessity of using them. It's very important for the chief executive of the organization, or at least that part of the organization, to also be bought in. It's important for your financial staff and financial planners to understand how they are going to be able to pay, the organization is going to be able to pay for the use of these medications. So there are several layers, really, of leadership that need to be willing. I think there are two key ways. One of them is certainly the presentation of information and data and the evidence itself. Every treatment agency and every treating provider wants to provide the best care that they can. Right? So it's important for them to understand what that is, given the information that we have now. And it shifts over time because it is a younger field, right? The use of medications for substance use disorders was nowhere near as widely spread 10 years ago as it is today. And the evidence for using it is using medications is stronger now than it was then, and will be stronger in the future. So it's important to present that kind of information. And that's why I say we really need a clinical champion who has that information and is in a position to be able to disseminate that to his or her colleagues. The other important way, I think, of developing buy-in is to do pilot testing. So if you have 0 patients on a medication such as buprenorphine, and your organization is concerned that it can't handle the patients, maybe because they have very little experience or they don't know what they're getting into, then it's really helpful to have 10 patients on the medication and see what you really learn from that, right? So most organizations will give you permission to go from 0 to 10. They may not want to give you permission to go from 0 to some unknown number until they really understand what it looks like. So that concept of pilot testing, I think, is a critical way to enhance buy-in at both the leadership level and the staff level. Because usually what you learn is that the things you were afraid would happen don't happen. Or if they do happen, you already know what to do. One of the most important things is to provide information about the efficacy or effectiveness of the various treatments. And it is critical for family members, community members, and people who may be affected themselves to understand that trying to recover from an opioid use disorder without the use of a medication means that you're less than 10% likely to have a meaningful period of recovery. What we mean by that is the non-use of a medication, of an opioid, for at least 12 months. With the medications, your chances go way up. If you're talking about any other chronic disease, we've made that information much more widely available in our communities. So I think that part of the strategy for having persons be willing and wanting to take these medications is to have all professionals in the healthcare field really understanding the effectiveness of the medications themselves. So if you go to your dentist, or if you go to your primary care provider, if you go to your pediatrician because your 20-year-old son, you're worried about him or her, you're worried about your son. In that particular case, you want the pediatrician to know that medications are the most effective route. So there remains a a social and cultural lack of understanding about the effectiveness of the medication, and there remains this set of ideas that somehow using the medication means you're not really in recovery from the illicit use of opioids, right? We don't talk about other chronic diseases in the same way. So for example, a person who's diabetic, we would never encourage that person to go off their medication or not take the medication if it were clinically indicated to do so. We would never say that the person is failing treatment if he or she can't stick to their diet. So this is the kind of sea change that I think we need to make around understanding and talking about addiction and addictive disorders, is that we need to understand them as chronic relapsing illnesses, and we need to use strategies that are already well proven in other chronic disease management.
Watch the other videos in the series, which cover the physician's perspective, concerns about diversion, finding funds, and recruiting prescribers.